The stories shared on It Takes Balls are unique to the individual sharing. Always speak with your trusted medical provider for treatment options specific to you. Welcome back to It Takes Balls, presented by Testicular Cancer Awareness Foundation. Today, we are joined by one of our speakers from our past conference in 2023. Dr. Geo Espinosa, or Dr. Geo as you may know him, is a Department of Urology faculty at NYU and a doctor of naturopathic medicine. So Dr. Geo, thank you so much for being here.
Stephen, thank you so much. I had a great time speaking at the conference and really great time meeting everyone, including you. So I'm glad to be here.
Before we jump into testicular cancer specifics, what is naturopathic medicine, and kind of talk about some of the misconceptions about it?
Yeah, great question, and is a great way to start. So, naturopathic medicine is a doctorate program where you become a physician and you're licensed to practice as a physician in some states and many states around the country. And really, it's 4 years post grad. First 2 years is very similar to any medical school. The last 2 years focuses on natural therapeutics, things like clinical nutrition. So this is beyond just calories in, calories out, the impact on nutrition and nutrients as it relates to disease and overcoming disease, botanical medicine, exercise, all kinds of natural and lifestyle approaches to help patients get better. Within that, we also go through pharmaceuticals and learn what's really important from a pharmaceutical perspective that's may be necessary to help our patients. So that's in a nutshell, no pun intended. That's what naturopathic medicine is. And then I just did an extra training in functional medicine, which is a science-based systems-based type of medicine, when you look at the interrelationship of all the systems and how they impact the other. So the respiratory system, the psychological, psychiatric system with the urological system, how they all interrelate. And then I just decided to do more men's health and urology. So I took narrow routes to the point where, I practice what I do now.
Awesome. And naturopathic medicine sometimes I think can have some misconceptions. And I know at the conference you had said that, the chemo and everything for testicular cancer is so effective that we're not talking about alternatives. We're talking about supplemental stuff here.
Yeah. So it depends. In some cases, depending on a scenario, it's very important. I have found throughout my career that no one gets too bogged down into what they do and then nothing else works or matters. Certainly we have our conventional colleagues, some of them now they're more open-minded than ever before, but it used to be that, hey, don't do anything natural. Same thing, some of my own colleagues in the naturopathic world, so don't do anything conventional. It's very important to know your craft well, and in my case, how herbs and nutrition works to help patients, environmental factors. And then it's very important to know the conventional side, not only what doesn't work. And there's many things in conventional medicine that unfortunately doesn't work or is not as effective, but what actually works, so that now all we care about is to provide the best care we can and to do the best we can for our patients to do better and to heal from their disease. The modality doesn't matter. Now, that said, there is some inherent bias that we all have. My inherent bias is that natural methods, it's a great way to go for many conditions. With testicular cancer, as I said in the conference, it's one of the 3%, unfortunately, only about 3% of cancer patients overall benefit from chemotherapy. Testicular cancer is one of that 3%. So it's very important to understand that it works. And perhaps what else can I do to support my health after I get treated so that I can promote my longevity and thrive despite my history of testicular cancer in this case.
Yeah, and you said thrive there. That was my next point. Is you mentioned you used thriver rather than survivor.
Correct.
So why is that?
Words matter, Steve. Words matter. How you describe your experiences, your perception matters, and as to how you feel. Survivor implies what? Implies, oh man, I'm just making it. I'm not quite there. Oh, thank God! You know, it's like I'm just making it. I'm almost there. Or, you know, it doesn't imply living your best life. And I think that thriver is just a better word. How can I? And look, no one is undermining the the components of the process when somebody has testicular cancer, right? And yes, it's a deadly disease. So I'm not undermining that at all. And yes, you have to survive before you thrive. So we get that. But at some point, we have to sort of look at it and call ourselves, or those that have been diagnosed, thrivers, particularly if you are actually doing well, if you're actually overcame the disease, if you actually, you know, are, you know, perhaps in every cancer case that I've seen, and the two main cancers I see is prostate cancer, and one I do see testicular cancer, is an opportunity to reevaluate what matters, or reevaluate what's important, and to not take things for granted, particularly if you happen to be in good health after your diagnosis and your treatment. So after that point, I think it's very important to consider yourself a thriver, not a survivor.
And I think that was probably one of the biggest takeaways from the conferences. I've seen a lot of people in the support group kind of introducing themselves to others as a thriver now rather than a survivor. So that's awesome. Awesome. You mentioned like environmental factors. What are some of the environmental factors for testicular cancer? And I know you talked prenatal, pregnant, postnatal, and maybe that's two separate subjects there, but
we can combine them, because I think it has an impact on both prenatal and postnatal. Testicular cancer seems to be very different from other cancers. It's almost like the healthier you are, the more likely you are to get testicular cancer, all things considered. If you're white versus black, you're more likely. Blacks are at a higher risk of everything, almost, as it relates to getting a disease, except testicular cancer and a few others. If you have a higher BMI, meaning if you're a little bit more overweight than others, that actually is protective. Or I don't know if it's protective, but there's connections showing that, you know, if you're leaner, you're actually at a higher risk. So if you're leaner, white, and a certain age, between somewhere where 15 to 40, 44 or whatever, you're at a higher risk. Right? So what's going on here? There are two very important factors in my mind as it relates to a higher risk of testicular cancer. One is genetics, and the other is environmental. Period. End of story. And particularly if you have a family history, if you're white, and if you're, very athletic, not that these are correlations, not causation. So it's very important to, I don't want to give anyone an excuse not to work out. Right. You know what? I'm just going to keep eating these cheeseburgers and fries with my milkshakes because I don't want to have an increased risk of testicular cancer. No. That doesn't work that way. But all things being equal, you increase your likelihood of developing testicular cancer from a genetic perspective, and there's environmental contributors. The environmental contributor starts prenatal. Now, it's very important that mothers live their life in guilt anyway, how they're not giving enough to their kid or their spouse or their work or whatever. So this is not what we're trying to do here. But it's important to look at this for the future mothers who may be pregnant with boys. If the mother is exposed to environmental, what's called xenoestrogens, XENOESTROGENs, xenoestrogens. These are environmental toxins that are out there. Some of them are pesticides that are sprayed in our food, for example, plastics. They have xenoestrogens, phthalates, and things of the sort. If they have a high levels of xenoestrogens and they're pregnant with a male, with a boy, then that increases the likelihood right from there. Then oftentimes you see cryptorchidism, which is undescended testicles. You see hypospadias, which is, the opening of the urethra is not in the head, is somewhere else. All these things increases the likelihood of testicular cancer. So it starts there. And then it continues on, postnatal, in terms of increasing the likelihood. If you are exposed to these xenoestrogens and you have a genetic predisposition. Okay, genetic predispositions include family history, but also includes just genetic testing for it. I'm not going to go over all the genes and mutations because they are just a bunch of letters, but that can be looked up on the internet or on my website if people would like, was drgeo.com. So I think the number one thing before we start talking about nutrition, again, what nutrition when you're 15 years old, or most kids are eating more or less the same thing, but most people don't get testicular cancer, most men. When we're talking about the natural approach, it starts with environmental and excluding environmental exposure to many of these chemicals. Period. End of story. And again, it starts with the mom and it continues on with the kid.
So if it's like you're talking about prenatally, if somebody has just found out that they're pregnant, but they don't know the gender yet, right? So what are things that they can do to kind of start being extra precautionary to prevent this toxic load?
Yeah. Eating clean. What does that mean? Eating clean, there's probably many definitions. So in my mind, eating clean means eating the best possible foods you can eat that are nutrient dense, that are very low in chemicals, that are not unnatural to us. So I would eat organic. It's a little bit of an extra cost, but if you're going to be a parent, just get ready because everything is going to be an extra cost moving forward. So, I mean, just get, and that was a little tongue in cheek, but I also would say that when families do their budgets, don't skimp on good food. Don't be cheap on good food. Right? So figure out how to leave other things out that are maybe a little bit less important. And with your food, buy the best quality food. And yes, unfortunately, the best quality food is typically more expensive. I wish that was not the case, but it is. And the best quality food is the food that is least contaminated with chemicals. So then organic foods are that. Now, let's just say, wow, I cannot, get organic squash and many things. What people can do is they could look up the top 15 foods that are most contaminated that should be organic. The other foods maybe do not have to be, like avocados don't have to be, for example. Oranges don't have to be. But let's say things like spinach and strawberries should be organic because they're like top two, actually, in terms of foods that are most contaminated. You find this list in the EWG.org website, Environmental Working Groups website. Okay, so if you can't get everything organic, and you may not have to get everything organic, get the top 15 foods that are organic. It's called a dirty dozen, but there's more than 12.
Okay, so if somebody goes to Chipotle or something and they get a burrito, is that cleaner than going to Burger King?
That's a great question. Wow. That's a great question. Here's the deal. Here's the inconvenient truth. You lose control of the food you eat and the quality of the food you eat when you start eating outside of your home. Okay, so then what do I do? Because what I'm going to, I'm going to go to events and so forth. What you do is you don't eat the top 15 foods in a restaurant. So I never have spinach, for example, in a restaurant. And so then, it's an interesting thing, Steve, because, I go, I have food with friends and they're trying to impress me with their, decision making on what they're going to eat. And they get spinach and they get, as I look how healthy I'm eating, I'm not getting spinach. And they're like, they're trying to one up me, like, oh, wow, look at Geo, you're not eating as healthy, but I'm like, yeah, it turns out that spinach is not healthy if it's not organic, actually. They get strawberries, and I don't really eat strawberries if it's not organic. For dessert, they get strawberry for dessert or something, right? And I don't know, I may share actual dessert. And they're trying to one up me. I was like, well, I'm eating something healthier. I'm like, well, I'm not sure. Right. So when you eat out, I would say, and by the way, I do encourage people to eat out. I want to, it's not like just take your food to the restaurant and then open your food as everybody, there has to be a holistic but realistic element to this. When you eat out, I would say eat the best food you can and do not eat anything that's like top 15 in terms of whether it's organic or not. Don't eat it if it's not organic. The top 15 foods. These are, by the way, these are foods. These are fruits and vegetables, again, that most people eat because it's healthier. And I would say don't eat those.
Interesting. Extremely interesting.
Unless it's organic.
So then is that throughout the entire pregnancy? And then you mentioned postnatally, like the genetic testing.
Correct. So genetic testing to see predispositions doesn't necessarily mean that you're out of the woodworks, but it means that you're at a lower risk. And then for the mom to breastfeed for at least 6 months.
Okay.
There's a correlation there. Now, some moms, I have a family member, the kid is 2 years old, still breastfeeding, right? So that may be helpful. From what I've seen in science and, observational research, at least 6 months, you want to breastfeed.
And I guess this maybe would be considered prenatal, but for the guy's side, like if a guy has a lower sperm count because he had testicular cancer and had a testicle removed, are there things that he can do to kind of pump up his volume and the health of his sperm?
That was a song back in the day. Pump up the volume, pump up the volume. Pump up you're taking me back to my college days, Stephen. Pump up the volume. Yeah, so correct. So once the male is of a certain age, let me take it back a step, then you want to do a semen analysis. I think a semen analysis is good for everyone to do, regardless. There's a lot of correlation with not only fertility, but just even mortality. And certainly testicular cancer, right? So that's a good thing to do. If their levels are low, the volume is low, all sorts of things to do in that regard. Particularly, you want to lower oxidative stress. So you want to lower the production of free radicals. And you do that by consuming good food that have a lot of antioxidants plus supplementations. Things like vitamin C, vitamin E, CoQ10. Actually, it's called ubiquinol. CoQ10 seems to increase sperm count as well. Certain botanicals like ashwagandha seems to increase sperm count as well.
Interesting. Why you mentioned like the mortality with the semen analysis? Can you expand on that?
Correlation. I don't know what other than I don't know exactly the how it contributes to it, but big studies have shown that those with low sperm count, and not only sperm count, but abnormal sperm cells and so forth, have a higher risk of mortality from many things, not just testicular cancer, than those that have normal volume and healthy characteristics in their semen.
This question might be kind of an unknown in the urology world too, but like, is there any, if you look at sperm before somebody's diagnosed with testicular cancer, is there any like sign that maybe there's something going on? Because I know it's the germ cells.
Yeah. I don't know. And it's just one component that you would look at. So if they have a low sperm count, doesn't necessarily mean they'll develop, testicular cancer, of course. But yeah, exactly how that's correlated, I'm not exactly sure.
No worries.
There's theories, but we won't get into them.
Just kind of a question from left field here, and I hope this person that I'm going to reference talked to you at the conference. But she asked a question the first day, you were there the second day, about acupuncture, and her brother was back in India. And acupuncture, I think, is something that you are specialize in, right?
Correct. So I'm also a trained acupuncturist on top of the naturopathic doctor.
So she had asked, her brother in India wanted to do acupuncture as kind of a complement to his treatment, and the doctors there were against it, and they said that there was an infection risk. So, I mean, is that true?
If there's an infection risk, there could be that in India there's a higher infection risk than in the U.S. Why would that be? Because they may reuse the same needles and sterilize them, but not do a good job sterilizing them. I'm guessing, because that's historically, there was, people transferred hepatitis from acupuncture because it was not a sterile environment. And I have no idea what are the rules and regulations in India as it relates to acupuncture. In the US, we use the needles only once and then we discard them. So you only transfer any type of pathogen if that's not the scenario. And also you have to wipe the area that you're going to insert the needle with alcohol prior to insertion. So there's levels of decreasing the possibility of infection. I've never seen an infection, and I haven't even read of an infection that's been written in a scientific journal for a very long time. It's been over 20 years.
Are there benefits to acupuncture for somebody who's maybe, say, in chemo now or, post-surgery?
Yeah. So the main benefits while in chemo is to reduce some of the side effects of the chemo. So a little bit less fatigue, for example. If there's neuropathies, where there's tingling or sensations in the extremities, then that's relieved as well. Not necessarily, as best as I know, to help with as a treatment for the cancer itself.
Is this something that's covered by most insurances or with a referral?
Actually, one of the few diagnoses that it does cover is for chemo, cancer patients and chemo, and then pain. So, and then only in some. So Medicaid and government insurance does not cover it. Some of the private insurances do.
Interesting. All right. I want to move on to what you talked about at the conference, endocrine disruptors and PCBs and phthalates and those kinds of things. So what can you tell me about those?
So these are all estrogenic xenoestrogens, also known as endocrine disruptors, really disrupting the hormonal balances of your body. It mimics estrogen in the body, so it can attach to receptors. Estrogenic receptors, then it causes problems when there's too much of that, attachment of these, xenoestrogens on these receptors. You find these PCBs and phthalates you find in plastics. So a real life scenario is, so how do I get these chemicals in my food or anything I'm drinking? In general, the softer the plastic, the more phthalates and PCBs it has, right? In general, the harder the plastic, the less of these chemicals, right? And one of the ways that you get these chemicals in the food or or anything that you consume, a consumable, is when that plastic is exposed to heat with the consumable in the plastic, of course. So, for example, if you tend to leave your water bottles in your car in hot summer days, that's not a great idea. Okay, certainly heating food in a plastic or microwaving food in a plastic is not a great idea, right? And then, of course, you don't know the history of that water bottle when it got to when you purchased it, right? You don't know if it was exposed to heat or not. So, in general, you want to stay away from plastics if possible. So either have your own, metal filler of, where you fill your, by the way, you guys in the testicular conference, cancer conference, it was, I still use your water bottle. That's, good metal, and certainly it doesn't seep any of the chemicals that are a problem. So I thank you guys for that.
Yeah, these are perks of coming to the conferences. So there's another one we're planning for September. So hope to see everybody there.
I love it. I hope so too. Yeah, you guys are doing great work, by the way. Thank you. I really appreciate all the work that you guys are doing. It's very important.
Oh, thank you. I didn't mean to interrupt you.
No, that's quite all right. So anyway, that's the deal with those type of chemicals. So is those chemicals and really, the organochlorides, which are a big part of the pesticides that are sprayed in our food. Those are the two biggies in my mind.
When you talk about like water bottles, I'm kind of terrible. I'm a terrible person because I usually just drink straight from water bottles. But like, then there's contaminants maybe in the water that comes from the city. So how do you justify one over the other?
Well, you want to drink. So the best way to go about it, and there is no perfect way, right? I'll tell you in descending order of priority. Okay. You have a filtering watering system in your house. You fill up your water bottle. That's metal, as a metal bottle, let's say, and then you carry that with you. 2, you purchase water in glass. There's a few companies that do that. Mountain Valley is one of them. And then you carry that. Downside is heavier, and of course it can break if it falls. So that's 2. 3, you get water from thicker, more sturdy plastic bottles, not the softer ones. Right? That's 3. Of course, you don't know that if there's a history there of exposure, but hey, you only could do, what you can. And then 4, if there is no 4, because I would not, if it's one of those plastic bottled waters, I'll say a brand, and it's like, come on, you could do better. You're a $1 zillion company. Poland Spring, like the water bottle is like, you can squish it, right? It's like, come on, you guys could do a lot better. And this information is there. This is science. It's not opinion. So that's one of the water bottles or the companies that I don't drink unless it comes in a sturdy, phthalate-free big container that you have in your house. And then you get water from there.
So I have probably screwed myself drinking hundreds of water bottles. It sounds like I need to outfit my sink with a filter.
Yeah, well, you don't know what you don't know. I think, so then if you're going to be a parent, if you're a parent, then you're going to realize that you have a whole lot less time in your hands, and you're going to try to cut some corners because I don't got time for, prepare every food that I take with me and then so forth. I would say that having a metal container, and filling that up with water in a water system, it's a time well spent. And then perhaps adding in electrolytes to that, like a scoop of electrolytes of any kind almost, because I think that just H2O alone, I mean, now we're kind of digressing a little bit, so bear with me. So in terms of just general health, you don't want just water alone. You want some of these electrolytes, as chloride, sodium, potassium, and that's what you really want. and you put that in water, particularly on hot summer days where you're sweating, and certainly if you're working out, that's the best way to go.
Is there a safe additive to water that you would recommend?
Additive as it relates to what electrolytes that I was just mentioning?
Yeah.
Yeah, sure. I mean, by the way, this is like kind of it's just like a better alternative to sports drinks that is just filled with sugar and artificial colors. There are quite a few. I mean, I don't know. There's one that's very popular now called LMNT. I have no association with that, and it's very high in sodium, but in a good way. I know people trying to stay away from sodium for blood pressure, but no, this is good. There's many companies out there. Thorne has one that is pretty good. Jigsaw is another company that I use a lot of. I want to make sure that the sodium is at a decent level because it is important. People are trying to stay away. Again, we're digressing a little bit, and probably nothing or little to do with testicular cancer, but those are pretty good companies.
All right. Well, we'll get back on track here with kind of what your presentation was at the conference. Speaking of like drinking liquids, alcohol was something that you had talked about in like the consumption guidelines.
Yeah. There again, with alcohol, I want to be clear as to what is associated with testicular cancer and what's not. But even what's not, of course, we don't want to have, other problems. I'm not sure of the exact correlation. I mean, a 15-year-old, how much is he drinking, right? Or an 18-year-old? Some 18-year-olds are drinking quite a bit, but but general guidelines that I've given for now we're talking about more like longevity and better with age kind of thing.
Thrivership.
What's that?
Thrivership.
Thrivership. Yes, that's even a better term. The guidelines that I've figured out through research and just dealing with it quite a bit, not as a clinician, is no more than 2 drinks a week. Which for some people is like, are you kidding me? I mean, like that's a Saturday night. There's 4 or 5 drinks, right? So no more than 2 drinks a week. And understanding that there is no benefit to drinking alcohol, first of all. Yeah. Whatever preconceived illusions we've had that no, a little bit is good, it helps with this, that, there is no health benefit to drinking alcohol, okay, or alcoholic beverages. If you are, then 2 drinks a week. If you're going to break that rule and say, okay, man, I had 4 drinks a week. Okay, no problem. It's better to separate them and not have 4 drinks in one day as opposed to, 4 drinks or 2 and 2 or 1 and 4 days, or it's just better to separate them. And lastly, it's better to drink about 2 to 3 hours away from bedtime because alcohol disrupts sleep quality, and sleep is very important for thrivership. So those are the general rules.
Kind of on the topic of alcohol, like the damage that it can do to your livers and maybe your kidneys, and that's kind of urologic. Chemo obviously affects, that runs through those organs as well. So are there natural ways to kind of restore any damage that might have been done from chemo to your urologic organs?
Yeah. Well, certainly you mentioned liver, which is not a urologic organ, but I think is a very important organ to have. Everything goes through the liver. You need in order to thrive after testicular cancer, you need strong liver. There's several herb botanicals that are really good, like milk thistle and schizandra. These are botanicals that I use to kind of restore the liver. Magnesium is a very good, important mineral for many things, but certainly for liver restoration. not to get overly scientific and go down a different rabbit hole, but what the liver does primarily is detoxifies, right? So it's a filtering system. And it's one of the most important filtering systems in the body. How it does that, it goes through two phases, phase one and phase two. So let's just say that you have something in your body that it's not normal to your body and your body needs to get rid of. Let's just say that it's a chemical, a chemical, one of these phthalates or xenoestrogens, let's say. That chemical needs to go through a phase one system. And in that phase one system, it's converting that chemical, because what it's trying to do in the detoxification process is trying to get rid of it. Well, you can only really get rid of it through your urine or fecal matter, right? So how can I make this chemical, which lodges actually in fat cells and things like that, unless you convert it, how can I convert it so that my body gets rid of it? It goes through phase one. That byproduct from phase one can actually even be more damaging than the original product. It has to go through a phase two system for your body to really get rid of it in a safe way. There's important nutrients that are needed in phase one and important nutrients that are needed in phase two for that process to occur. If anybody looks for, like, let's say, functional medicine detoxification pathway or anything online, you see those nutrients. I don't want to get too much into that because it's just a few and so forth. Anyway, B vitamins, for example, and magnesium is an important part of that. And when we talk about liver health, we're talking about detoxification pathways that are very important.
Okay. And then I don't think you touched on this in the conference, and if you don't want to, I can edit it out, but weed is something that a lot of people are talking about in the support groups and on Reddit, like whether they should smoke to, reduce side effects like nausea, or take edibles. So do you have any thoughts on that?
I do. Again, this is holistic and realistic. The research correlates I'm not sure if it's only smoking of cannabis, but intake of cannabis with testicular cancer. It also correlates it with poor semen quality and semen health. So it also correlates it with low testosterone. Okay. Now, two things: recreational and medicinal. Recreationally, and I am, I'm not judging or, saying do or don't do. Recreationally, what we don't know, what's the poisonous dose? We have to assume that there is a poisonous dose. So somebody that smokes once a day, somebody that smokes, we all know people that smoke every day. We know people that smoke all day, every day. We know, so weekend smokers versus everyday smokers versus, every other day smoker, what's the dose that is poisonous and can increase the risk? We don't know. We know that there is a connection. Okay. For medicinal purposes, in terms of, somebody on chemo that takes it for nausea or to improve their sleep, it's a trade-off. And so you have to, it's a risk reward analysis. The reward might be much greater than the risk in somebody who's already been diagnosed and it's on chemo. And now this medicinal cannabis helps them with sleep or nausea or whatever. By the way, acupuncture helps with nausea from chemotherapy as well.
Okay. Yeah, I don't smoke. I've never smoked. I've never taken an edible, so I don't know much about that. But I definitely.
Neither. I'm. Well, maybe you and I are the only ones that. I don't know if you went to college. Every time I talk to someone, is like, really, you never smoked weed and you went to college? It's like, yeah, I didn't smoke weed.
Yeah, I don't drink alcohol either.
Everyone did around me, and I did consume alcohol, and even that, it was a weird college experience because in the parties everybody's smoking, and I'm not now. I'm getting probably contact high, and I don't know what effect that has. But in any event, but I don't want to impose my views or my biases, right? On cannabis or weed. I want to be as scientific as I can and objective as I can. If you're going to smoke, there is a poisonous dose. I don't know what that is.
Gotcha.
First of all, you need to smoke every day and so forth. That's a problem. If you need something to numb you every day, whether it's alcohol or, cheeseburgers or weed, whatever it is, whatever the substance is, that you have to look into that anyway, right? As opposed to recreational. And even recreational is like, okay, well, you're hanging out with some friends. And by the way, again, a little digression, you're hanging out, men hanging out with friends is very important. That's a very important part of thrivership, right? Engagement with others. And when we talked about alcohol before, I forgot to say that if how you get together with friends is over a bottle of whiskey, and you could stick to that rule of 2 drinks, I would say that's a good thing. Because the engagement with friends probably, overthrows the, whatever ill effects from the alcohol. I would say the same thing with weed. Right? So have less of it. If it's an engagement scenario, perfect. And, just like with alcohol, you don't want to, drink to the oblivion. You don't want to smoke until you lose control, because that's never a good thing.
Yeah, that makes sense. And I appreciate you answering, because that's not something I don't think we've talked about on this podcast. And I think there's a guest coming up later this year who is kind of an advocate of it. So I just wanted to kind of get your thoughts before I talk to him. I'm sorry, because the advocates, I have friends that are advocates. I was like, well, you can't say just take as much as you can or as much as you want. No, you can't. You can. By the way, I saw the problems in college, and the comparison to alcohol is not a good comparison. Well, it's better than alcohol. Well, alcohol is really bad. Actually, if it were to be a new substance, it would not be legal. So, and it was illegal for 7 years back in the day, and there was a reason for that. So, it's not a good comparison. That is So, I think what we need to do is, and even from a medicinal perspective, because I have many friends in the field that are physicians and clinicians, they're saying it's the Wild West. It's the Wild West. We don't know what type of cannabis helps with what exactly. We don't know the exact dosage. And we do know that it starts affecting you negatively, your health negatively, if you take too much. So I think there's a lot of work to do in that regard. Sorry to go back on that, but oh, no, you're good. Yeah, with it becoming legal and everything, these are things that are going to be figured out. So yeah, that totally makes total sense. As we come down the home stretch here, you touched on testosterone a little bit, and Dr. Burney from the conference, I'm going to have her on to talk about testosterone as well. But are there any kind of natural ways to raise testosterone levels?
Yeah. Great question. Gathering my thoughts, because it's not as simple as just raise testosterone, right? Doesn't quite work that way. What you want to do is raise free testosterone. What does that mean? Testosterone is connected to this other molecule, and it's transferred throughout your body and connected to this other molecule called sex hormone binding globulin. A few other molecules, but this is the main one. And when it's too tied to sex hormone binding globulin, or SHBG, it doesn't do the work that you want it to do, the masculinity of it, or whatever, the strength or the muscle or this, or many benefits. It doesn't do the work. So you want free testosterone. So in my experience, and I'm going to have Dr. Bernie on my podcast too, the Dr. Geo podcast. So this is one of the questions is, personally, as a clinician, I do help and treat people with low testosterone. In my opinion, if you have low total, or what's considered low total, and there's a huge range between 300 and 900, which I don't know, you could be at 400 and still be low because, it's still in the low end, right? But the bottom line is this: you can have 700 testosterone and still have low free. So you're still going to have symptoms. You could have 350 testosterone, which is on the low end, but have a lot of free. So what we want is free testosterone at the end of the day. So then the question is, how do you do that naturally? And there's ways to do that naturally, right? There is exercising and certain exercise protocols. So for example, is very specific. You don't want to run marathons all the time because that lowers testosterone. So endurance activity tends to lower testosterone. Of course, if you run a marathon here, I'm talking about constant. I'm talking about people that are running 100 miles a week and doing 2 marathons a month, or doing the 100-mile endurance event, all the, that kind of stuff. Then that lowers testosterone. What increases testosterone is some type of weightlifting, some type of weight resistant training, about 10 repetitions, for example, 10 repetitions 6 times with 2-minute rests. Full body. I'm not just talking about bicep curls. It's not going to do it. You have to kind of do big muscles like legs, lower extremities, or back. Right? That does it. You need some dietary fat, actually. So fat helps. If you're too low in fat, you may not have enough testosterone. And then some botanicals are really good. Ashwagandha, once again, is one of my favorite herbs. It seems to help with that as well. Boron and magnesium separates the SHBG to the testosterone, so it frees it up better, for example. There's quite a few things like that. Something called Tongkat Ali is a very good herb from Asia. That seems to be good in terms of increasing testosterone levels and free testosterone, for example. And lastly, which should be the first thing actually, is sleep. Getting good quality sleep. So it's not only sleeping 8-9 hours, it's the quality. You need to be in REM, which is the phase 4 of sleep, to actually increase testosterone levels. Or the release of testosterone. It's not the production as much as the release of testosterone. You need good quality sleep, really essential.
Okay.
So then some people, to kind of put a button on it or a bow on that, it's a lot to do, right? And some people, I can't do all that. So in my protocol, when people are able to comply, they do great. For many reasons, and I don't judge. I'm not saying, well, you're weak or you're not disciplined, or no, this life. I don't know your life. Yeah, go ahead and do TRT and do testosterone treatment therapy, and that's a fine approach.
Okay. Yeah, that was great information, and I appreciate you so much being on this podcast. Is there anything else that you want to add that I didn't ask about, or just let people know again where they can find you?
No, thank you very much. And it's a pleasure to be on this podcast. And again, important work that you guys are doing. So thank you for doing it. drgeo.com is everything. So drgeo.com. That's where I can be found. And no, in terms of, again, testicular cancer, I think the two biggies is genetic risk and environmental, both prenatal and postnatal. That's the big takeaway.
Perfect. And I have to say, no shade to the other doctors that have been on here, but I definitely think you're the best dressed. So,
thank you. I appreciate that. The whole thing took a life of its own. The original reason, this is 15 years ago, started wearing a vest, right? It was because I didn't want to wear a white coat. I was like, I don't want to wear a white coat, but my tie got in the way in the middle of a physical exam. So all right, started wearing a vest. And so that took a life of its own in terms of how, like, a branding thing, which that's not my focus. I'm like, oh, I like vests, now people are not even wearing ties anymore, and I'm like, I like ties, and I like, bright color ties. So now it's just like, so it's like I'm always wearing one of these things, and it took a life of its own. So I appreciate that. That's the best compliment you can give me, Stephen.
I was looking at your website before we started, and I was like, man, as the kids would say, he's got that on.
He's got that on, right?
Dr. Geo, thank you so much for being on It Takes Balls.
It's my pleasure. Thank you. Have a great day.
For more information and resources for your testicular cancer journey, visit testicularcancerawarenessfoundation.org. You can also follow us on social media at Testis Cancer. We're on Facebook at Testicular Cancer Awareness Foundation.